Mumps. What is mumps? Mumps is a highly contagious viral disease caused by the mumps virus. This virus is spread through respiratory droplets, which are produced when an infected person coughs, sneezes, or talks. The classic symptom of mumps is swollen and painful salivary glands, particularly the parotid glands, which are located near the ears. How does mumps start? Mumps is primarily caused by the mumps virus, which is a type of paramyxovirus. This virus is spread through respiratory droplets, which are produced when an infected person coughs, sneezes, or talks, or through direct contact with saliva. This can occur through direct contact. Mumps can spread through kissing, sharing utensils, or being in close proximity to someone with mumps. Indirect contact. It can spread indirectly by touching contaminated surfaces, like toys, cups, or utensils, and then touching your face. What is the contagious period of mumps? Mumps is most contagious from about 2 days before symptoms appear, to 5 days after the onset of salivary gland swelling, Paratitis. Here's a more detailed breakdown. Before swelling, mumps virus can be present in saliva and respiratory secretions, even before any noticeable symptoms, like swollen salivary glands, appear. During swelling, the period of highest contagiousness is during the first few days, after paratitis begins. After swelling, contagiousness decreases after the first 5 days of swelling, but the virus can still be present and transmitted for a short period after that. How do mumps symptoms start? Symptoms typically occur 16 to 18 days after exposure to the virus. This is the incubation period of mumps that occurs before the start of infection. About 1/3 of people with a mumps infection do not have any symptoms, meaning they are asymptomatic. What is incubation period of mumps? Before the prodromal phase, there's an incubation period. It is typically lasting from 16 to 18 days, where the virus replicates, but doesn't cause noticeable symptoms. What are phases of mumps infection? Mumps symptoms typically progress through 3 phases: a prodromal phase, a Paratitis phase, and a potential complication phase. The prodromal phase involves initial symptoms like fever and headache. It is followed by Paratitis phase, which is the phase of swollen salivary glands. Finally, it can progress to complications phase like orchitis, meningitis, or pancreatitis can arise. Here's a more detailed breakdown. Number 1. Prodromal phase. After the incubation period ends, the prodromal phase begins. This initial phase occurs a few days before the classic mumps symptoms appear. Once the prodromal phase begins, symptoms can include fever. A low-grade fever is common. Headache. Headaches are another frequent complaint. Myalgia. Muscle aches and pains are also typical. Fatigue. Feeling tired and run down is a common symptom. Anorexia. Loss of appetite can occur. Duration of prodromal phase. The prodromal phase typically lasts for 3 to 5 days, before the onset of paratitis. Infectiousness. Individuals are contagious during the prodromal phase, typically from 2 days before paratitis onset, to 5 days after. Number 2. Paratitis phase. The paratitis phase of mumps is characterized by painful swelling of the parotid glands, which are located in the cheek and jaw area, which typically peaks in 1 to 3 days, and then subsides. Additional symptoms can include fever, headache, sore throat, loss of appetite, decreased saliva production, and fatigue. This is the most recognizable phase of mumps, marked by swelling of the salivary glands, particularly the parotid glands, located in front of the ears. The swelling can be on one or both sides of the face. Pain and tenderness in the swollen glands. Pain while chewing or swallowing. Timing. The Paratitis phase usually appears 12 to 25 days, average 16 to 18 days, after exposure to the virus. Duration of Paratitis. Parotid swelling usually subsides within a week. Number 3. Complication Phase. While most people recover fully within 2 weeks, mumps can lead to complications in some cases. These complications are more common in adults than in children. These include meningitis or encephalitis. It is the inflammation of the brain or spinal cord membranes, causing symptoms like headache, fever, and stiff neck. Orchitis. It is the inflammation of testicles. It occurs in postpubertal males, with about 25 to 50% of mumps infections leading to this complication. Mastitis. It is inflammation of the breast tissue, more common in females. Oophoritis. It is inflammation of the ovaries, more common in females. Pancreatitis. It is inflammation of the pancreas. Deafness. It is rare but can be a consequence of mumps. Patient can even die in very rare cases. Vaccination of mumps by the MMR vaccine. The most effective way to prevent mumps is vaccination. The measles, mumps, and rubella MMR vaccine is a safe and effective way to protect against mumps. And it's typically given to children as part of their routine childhood vaccinations. Maintaining high vaccination levels, especially in children, is crucial for community-wide protection. Here's a more detailed look at preventing mumps. What is MMR vaccine? The MMR vaccine is the primary method of prevention. It's a combination vaccine that protects against measles, mumps, and rubella. Vaccination schedule. The recommended schedule for the MMR vaccine is usually 2 doses. The first dose is given between 12 and 15 months of age. And the second dose between 4 and 6 years of age, or before starting school. Adults. Adults who haven't been vaccinated or don't have evidence of immunity should also get vaccinated. Ideally with at least 1 dose of the MMR vaccine. Outbreak control. In outbreak situations, a 3rd dose of the MMR vaccine may be recommended for those at increased risk of infection.